Doctor explains one vitamin seniors over 60 take daily for nerve health. If your hands and feet ever feel like they're being poked by 1,000 tiny needles, I need you to stop whatever you're doing and listen close. What I'm about to share with you helped one of my patients get the feeling back in her fingers in just 14 days using something that is easy to find and surprisingly cheap. But here's the part that scares me. If you just brush off that tingling or numbness, you aren't just dealing with a little discomfort. You are gambling with permanent nerve damage that can lead to nasty falls, a total loss of feeling in your limbs, and losing your independence. The silver lining here is that if you catch this right now, you can turn it around. And I'm going to walk you through exactly how to do that. I'm Dr. James Caldwell, and I've spent years helping folks over 60 take back their health and vitality. Today, I'm going to reveal exactly which vitamin your nerves are screaming for, why it works so well, how much you need, and the big mistakes most seniors make that stop them from getting better. Before we dive in, do me a favor and drop a comment below telling me your age and what country you're watching from. I love seeing how far our community reaches, and hearing from you helps me make videos that actually help. Now, I want you to be honest with yourself. Are you noticing any of these red flags? Do your hands or feet start buzzing or tingling when you're trying to sleep? Is it getting hard to tell if water is hot or cold when you wash your hands? Are buttons and zippers becoming a nightmare to fasten even though your hands look fine? Do you feel wobbly when you walk, like you aren't quite sure where the ground is? Or maybe you've got that burning sensation in your feet that just won't quit. If you said yes to even one of those, your nerves are sending you a distress signal that you cannot afford to ignore. Let me break down what is actually happening inside your body, because once you understand this, it changes everything. Think of your nerves like electrical wires running through your whole body, sending messages from your brain to your fingers and toes. But here's the problem nobody talks about. Those wires are covered in a protective coating, kind of like the plastic insulation on a lamp cord. As we get older, especially after 60, our body gets worse at maintaining that protective coating. When that insulation wears down, your nerves get damaged, exposed, and start misfiring completely. That is exactly what causes the tingling, the numbness, and that awful burning pain that keeps you awake. Now, here is where it gets good, and this information could genuinely change your life. There is one specific vitamin that your body absolutely requires to repair that protective nerve coating. Without it, your nerves simply cannot heal, no matter what else you try. With it, you can actually reverse the damage that's already been done. I'm talking about vitamin B1, also known as thiamine. This isn't just some marketing hype. In my practice, I've seen incredible turnarounds. I've watched people who couldn't hold a coffee cup without spilling it get their grip strength back. I've seen patients who couldn't feel their feet become steady and confident walkers again. I've seen folks who thought their active days were over get back to gardening, cooking, and dancing. These aren't miracles or lucky breaks. This happens all the time when people fix their B1 deficiency. The truth is, your body is tough and it wants to heal. Your nerves are built to repair themselves if they get the right support. They aren't broken forever. They just need the right fuel. And B1 is that fuel. Think of it like this. If you had a car and never put oil in the engine, eventually it's going to seize up. The parts grind together and stop working. Well, B1 is like the oil for your nervous system. It keeps everything running smooth, protects those delicate nerve fibers, and helps messages travel from your brain to your body without static. When you're low on B1, you're running your nervous system on empty. The messages get garbled. The signals misfire. You get that pins and needles feeling that drives you crazy. Your hands feel numb doing simple chores. Your feet feel like they aren't there, like you're wearing thick wool socks 24/7. Walking gets scary because you can't feel where you're stepping. You start bumping into furniture because your body's internal GPS is offline. But when you give your body the B1 it's starving for, the healing starts almost immediately. Your body begins rebuilding that insulation around your nerves. The signals start coming through clear again. The numbness starts to fade week by week. Patients tell me it feels like they are finally themselves again, like someone turned the lights back on after a blackout. Now you might be thinking, Dr. Caldwell, I eat healthy, so I probably have enough B1. Here is the kicker that most doctors won't tell you. Many adults over 60 are deficient in B1, and they don't know it until the nerve damage gets bad. Studies show that up to a third of older adults don't get enough B1 from food alone, and it gets way worse if you take certain medications. Why does this happen? There are three big reasons, and knowing them could save you years of pain. First, as we age, our stomach acid drops. That means we can't absorb B1 from food as well as we used to. Even if you eat perfectly, your body might only be absorbing a tiny bit of the B1. A healthy 30-year-old might absorb 60 or 70% of the B1 they eat. But after 60, that can drop to 20 or 30%. Same food, same meal, but your body just can't use it anymore. Second, common medications actively block B1 or drain it from your body. If you take meds for diabetes, especially metformin, or water pills for blood pressure, those can wipe out your B1 levels over time. Some heartburn meds do the exact same thing silently. These pills help one problem but cause another that nobody warns you about. I've seen patients on these meds for 15 years with nobody checking their B1. They develop nerve damage, and everyone assumes it's just getting old when it's actually a vitamin deficiency we can fix. Third, even if you eat B1 foods like whole grains or beans, modern food processing strips the vitamins out. White bread, white rice, processed snacks, they are basically empty of B1. Your body's working hard but running on fumes. Let me give you a real-life example. I had a patient named Robert, 71 years old, sharp guy, very health conscious. He walked daily, ate his veggies, avoided junk. He did everything right, but he came to me because the numbness in his feet was getting worse. He said it felt like walking on sponges. He couldn't feel the pedals when he drove his car, which terrified him. He was worried about diabetes complications or circulation failure. We ran his blood work, and his B1 levels were in the basement. When I checked his history, he was on a diabetes pill and a diuretic for years. Those meds had been quietly stealing his B1 and nobody caught it. We started him on a B1 supplement immediately. Within 3 weeks, he called me, almost crying with relief. He could feel his feet again. He could feel the ground. He could feel the gas pedal. He felt stable for the first time in months. He said it was like his body woke up. That is when I realized how many folks are suffering for no reason, walking around with low B1, letting their nerves die off just because nobody connected the dots. They think it's inevitable aging, but there is a simple solution sitting right there. If you are over 60 and have any tingling, numbness, or weakness, you need to know that every day you wait, your nerves take more damage. Early damage can be reversed in weeks. Long-term damage takes months and is much harder to fix. Time is of the essence here. And get this, low B1 doesn't just hurt your nerves. It tanks your energy, your mood, and your memory. Some folks feel exhausted and blame age when they just need B1. Some feel foggy and worry about dementia when they just need this vitamin. So let's talk about exactly what you need to do. Pay attention because the specific details matter here if you want real results. You have to get the right form of B1. Not all supplements are the same. This is crucial. You need a form called benfotiamine. Regular thiamine dissolves in water and flushes out of your system too fast. Benfotiamine stays in your body longer and penetrates the nerves much better. Get the dosage right. For repairing nerves, I recommend between 150 and 300 milligrams of benfotiamine a day. That is the therapeutic dose. The great news? B1 is safe. Your body takes what it needs and pees out the rest. You can't really overdose on it. If your symptoms are bad, start with 300 milligrams. If it's mild, 150 milligrams might work. But for most folks over 60 with nerve issues, 300 milligrams is the sweet spot. Step 3. Timing is everything. Take it in the morning with breakfast. B1 gives you energy, so taking it at night might keep you up. Take it with food that has some healthy fat, like eggs or nuts, because fat helps your body absorb it. Put the bottle by your coffee pot so you can't miss it. Make it a habit. Set an alarm on your phone if you have to, because consistency is the secret sauce. You need it every single day. If you skip days, your progress stops or reverses. Think of it like watering a garden. Dumping a bucket of water once a month won't keep the plants alive. They need daily water. So what can you expect when you start this protocol? In week 1, you'll probably feel more energy before the nerve pain changes. Patients tell me the brain fog lifts within days. They wake up feeling ready to go. Week 2 is usually when the nerves start waking up. Maybe the tingling is less intense in the morning, or your feet feel a bit more real when you walk. These are the signs that repair is happening. Weeks 3 and 4 bring the big changes. The constant buzzing quiets down. You can feel textures again. You feel steadier on your feet. You stop dropping things. You feel confident moving around your home. By months 2 and 3, it's a whole new ballgame. Most patients tell me they feel like a new person. The burning is gone, the numbness is barely there, and they are back to doing the hobbies they love. Let me tell you about Margaret, a 67-year-old patient who came to me heartbroken. She couldn't feel her grandchildren's hands when she held them. She was dropping plates and glasses constantly. She was scared she'd lose her independence and become a burden. She felt like she was walking on a boat, totally unsteady. She'd fallen twice in 6 months. Her daughter had to come over just to help her button her shirt. Margaret had been a professional seamstress for 40 years, and now she couldn't even dress herself. She felt embarrassed and frustrated. Her blood work showed severe B1 deficiency. We put her on 300 mg of benfotiamine daily. In just 14 days, she felt a shift. Her hands felt responsive again. In 6 weeks, she was buttoning her own shirts. She cried when she told me, because that little bit of independence meant the world to her. In 3 months, she was knitting again. She even made me a scarf to say thank you. But I didn't give her her life back. The B1 did. Her body did. I just gave her the roadmap. Margaret suffered for 2 years before seeing me. 2 years of unnecessary struggle. She didn't have to go through that, and neither do you. Before we finish, I have 3 important warnings for your safety. Warning number 1, get tested if you can. Ask your doctor to check your B1 levels so you aren't guessing. Warning number 2, if you have kidney issues or take a lot of meds, talk to your doctor first. B1 is very safe, but it's always smart to keep your doctor in the loop. Watch out for interactions. If you take diabetes meds or diuretics, tell your doctor you're taking B1 so they can monitor you. Also, here's a pro tip. B1 loves company. It works best with other B vitamins, specifically B6 and B12. They work as a team. So instead of just B1, look for a high-quality B complex that includes benfotiamine, plus at least 100 milligrams of B6 and 1,000 micrograms of B12. That combination is rocket fuel for your nerves. Listen, I know how hard it is to watch your independence slip away. It breaks my heart to see folks lose their confidence. That is why I'm so passionate about sharing this. You do not have to live with nerve damage. It is not just part of aging. Your body can heal if you give it the tools. Here is your action plan. Week 1, start taking 150 to 300 milligrams of benfotiamine daily with breakfast. Start today. Week 2, add a B complex with B6 and B12. Weeks 2 to 4, keep a little journal. Rate your numbness from 1 to 10 daily so you can see the progress. Week 4, see your doctor and check your levels. And remember, hydrate well and try to cut back on alcohol as it drains B1. Eat B1-rich foods like pork and beans. This protocol has saved the quality of life for so many people. It can work for you too if you stick with it. Now, I want to hear from you. Comment below, are you dealing with tingling or numbness right now? What are your symptoms? Your story might help someone else take action. If this video was helpful, please give it a thumbs up and subscribe to the channel Dr. James Caldwell. I make videos like this every week to help you navigate aging with strength. We are proving that your 60s, 70s, and 80s can be your best years. I'm Dr. James Caldwell. Stay strong, stay healthy, and I'll see you in the next video. If you found this video helpful, make sure to hit that like button. It really helps the channel. And don't forget to subscribe and turn on the notification bell so you never miss out on future videos. I'd love to hear your thoughts, so drop a comment below and let me know what you think. Thanks for watching, and I'll see you in the next.